Welcome to this guide on preparing for your doctor's visit. A short visit can be a big job, but walking in prepared helps you ask what matters most and leave with answers you truly understand. A typical appointment lasts only 10 to 15 minutes. By preparing in advance, you make every minute count. You are the expert on your own symptoms, and being organized turns a one-way visit into a focused conversation. First, let's look at how doctors reach a diagnosis. Understanding this process helps you see where your input as a patient has the biggest impact on the final result. Diagnosis is detective work. Doctors rely on three sources: your story, the examination, and tests. Your story is the richest source of clues, and it's the one part only you can provide. Your words matter. Vague descriptions like feeling off or tired are hard to talk on. Specific details, such as where pain occurs and how long it has lasted, point the doctor toward real answers. Some symptoms are stronger clues than others. If you have a symptom that is severe, unusual, or disabling, lead with it. This helps the doctor identify the most likely causes faster. The clock is another vital clue. The speed at which a symptom develops can suggest different conditions, ranging from electrical events to long-term processes. Describe the speed accurately to help your doctor. Understand the difference between suggesting and confirming. Most visits begin with clues that suggest a cause, while tests are used to confirm it. Ask your doctor, what would this test confirm or rule out? Not every health issue requires a new test or medication. Watchful waiting is often a valid plan. Instead of pushing for tests, ask about warning signs that would require you to return. Remember that your health is connected to your whole life. Things like your home environment, daily routine, and current medications provide important context. Be ready to share these details if they affect your care. Now, let's build your personal health file. Taking 20 minutes to prepare at home will make your upcoming visit much more productive and help ensure your main concerns are addressed. Start with your biggest worry. Even if you have several issues, pick the most significant one and write it in one sentence. Lead with this concern in your first minute to ensure it gets the attention it needs. For each symptom, prepare the details: what it feels like, where it is, when it started, how fast it appeared, its pattern, and what affects it. These 6 prompts will help you organize your story. Map your timeline: a clear picture of when the symptom began, how it changed, what you have already tried, and your current status prevents confusion and saves time during the visit. Finally, notice what changes your symptoms. Observe whether certain foods, positions, or activities make them better or worse. Identifying these patterns provides your doctor with powerful diagnostic clues. Next, build your medical history file. Keep it brief. Include past diagnoses, ongoing conditions, surgeries, and recent test results. You don't need every minor detail. Just the names, approximate dates, and clinics so your doctor can access the full records. Accurate medication lists prevent errors. For every item, including vitamins, supplements, and over-the-counter products, note the name, dosage, frequency, and why you take it. The easiest way is to bring the boxes in a bag or simply take a photo of them. Be precise about allergies. Distinguish between a mild side effect and a true allergic reaction. Describe exactly what happened, such as a rash or trouble breathing, so your doctor can determine if a medication is truly unsafe for you. Family history is a valuable clue. Flag significant conditions like heart disease, diabetes, or cancer in close relatives, parents, siblings, or children. If you know the rough age at which they were diagnosed, include that, as earlier onset often carries more weight. Your daily life provides context. Be honest about habits like smoking or alcohol use. These change the diagnostic picture and you won't be judged. Also, mention activity levels, diet, work exposures, recent travel, and stress, as these all shape symptoms and recovery. Don't hold back your hunches. Tell your doctor what you suspect is causing your symptoms and what you are afraid it might be. Voicing these thoughts allows your doctor to address your concerns directly, either by ruling them out or by providing reassurance. To wrap up your preparation, create a go-bag list. Your main concern: symptoms, medication list, allergies, medical history, family history, and lifestyle notes. Print this or photograph it so you can physically bring it to your visit. Part 3 of our guide focuses on your questions. With limited time, the skill lies in choosing the few questions that truly matter most and ensuring those are the first ones you ask. Avoid the temptation to ask a long list of questions. 10 rushed questions often lead to 10 blurred answers. Instead, focus on asking 3 key questions clearly, ensuring you get real answers you can act on. Use the quote top 3 feet rule. First, perform a brain dump at home, writing down every question. Next, circle the 3 most important ones. Finally, raise these 3 first during your visit, leaving others for if time allows. When asking about a diagnosis, prioritize these questions. What is the suspected cause? How sure is the doctor? And what else could it be? Is it serious or urgent? And what happens if you choose to do nothing? For tests, ask, what will this test confirm or rule out? Are there alternatives? What happens if I skip it? And crucially, how, when, and from whom will I receive and understand the results? When discussing treatment, focus on options. What are all the choices, including doing nothing? What does each involve? What are the risks and side effects? And what is the backup plan if the primary treatment doesn't work? To understand expectations, always ask, what happens next and by when? Most importantly, ask for the warning signs that would require you to come back urgently. This is your safety net for any health issue. Finally, connect the plan to your daily life. Ask if you can continue working, driving, or exercising normally. Inquire about any food or medication interactions, and ask if there is anything specific you can do at home to help recovery. Now, let's cover questions about follow-up. Always ask if you need a return visit, how to get in touch if things change, if a specialist referral is necessary, and ensure you get your results and care plan in writing. Sort your questions into 2 groups, must ask and nice to ask. Lead with safety and next actions, as these are the essentials. Leave the curiosity and background questions for if time allows. You can use a simple template for any appointment. Define your main concern, your top 3 questions, and note what you need to know before leaving your diagnosis, plan, warning signs, and follow-up. Take a photo of it so it's always on your phone. Part 4 covers your behavior in the room. You have already done the prep work. Now use a few simple habits to keep the visit focused and ensure you fully understand the outcomes. Open the visit strongly by setting the agenda in the first minute. State your main concern and the 3 questions you need covered. This frames the time, prevents last-minute scrambles, and is a practice most doctors appreciate. Be specific with your information. Swap vague phrases like a while or sometimes for concrete data, like 2 weeks or 3 times a day. If you tracked symptoms, dates, or counts, share those numbers directly. If you don't understand something, ask for an explanation in plain language. Then, play it back by saying, "So you're saying." This teach-back method is the best way to catch misunderstandings while you are still with the doctor. Anxiety can make it hard to remember details. To capture the visit, take notes yourself, record the conversation with permission, or bring a companion along to act as a second pair of ears. Ask for a written summary before you leave. It should include your diagnosis, your treatment plan, a list of your medicines, and the specific warning signs that mean you need to return or seek urgent help. Run a quick check before you exit the room. Confirm you know your diagnosis, your next steps, warning signs, and who to call. If the answer to any of these is no, ask again before you leave. Part 5 addresses life after the appointment. Remember that the visit is just the beginning of your recovery process. Consistent follow-through is what turns a good appointment into a positive health outcome. Capture your thoughts immediately after leaving. In the parking lot or waiting area, write down the key takeaways while they are fresh. Compare this to your written summary and list any questions that remain unclear for future follow-up. Track your progress. A simple log showing the date, your symptom intensity on a scale of 1 to 10, your medication, and any observations is extremely valuable for your doctor during your next visit. Know when to return or seek a second opinion. Go back if warning signs appear or you aren't improving. Seeking a second opinion is perfectly reasonable, especially for serious diagnoses or big decisions. In summary, walk in prepared to change the conversation. Use your story. Be specific. Limit your questions, confirm your understanding, and keep tracking. Preparation empowers you to be an active partner in your own healthcare.